but I'm asking you how. I mean, I know you used to look at the impact on public health, Mr. Administrator, and say, this is going to cost this family who has a kid with asthma $3,000 more. And so if we implement this regulation, we're going to help that family. If you say you're going to calculate it, I'd like to know how, because you've thrown out.
We calculate the emissions reductions. We calculate the cost of achieving reductions.
How?
So we have dedicated career scientists who work on this.
But how do you measure that and then compare it?
You can't put so like what's the value of a life to you? And I'm not trying to ask you a trick question, but that's what the problem from the scientific community is that the modeling that they were using, the scientific community said to me, to EPA, that instead of having an arbitrary number that's misleading the public, that you need to improve the modeling. Yeah. So we can continue to factor in the impact, but the monetization of it, we're not going to put an arbitrary dollar amount. And again, not a novel concept. This is exactly what happened with the Biden administration as well.
Mr. Administrator, you keep saying arbitrary. The cost to a kid's health from asthma
the number
is not
the
arbitrary.
Number is. How much would you say is the value of a life?
You know,
that's the problem that science is having right now. They're trying to figure out what the exact number is to utilize.
I know you want to jump to the big question about the value of life. I'm talking about the cost.
But that's what you're asking.
No, I'm talking about the cost to a family of a kid who has asthma, and then you pass a regulation to make sure they don't get asthma or don't get it aggravated. You can do those costs. It's not arbitrary.
Absolutely.
Okay, so let's make sure that we get to that where we can compare apples to apples.
That's not the hard part.
Here's the thing.
We have to come up with.
I already told you what the CDC, a federal agency, says the additional cost to a family is of a kid who has asthma. They say it's over $3,000.
You started off your remarks by saying that I should be listening to the dedicated career staffers at the agency, and now you're telling me that I shouldn't.
No, we have
the dedicated career
staff in the government.
Exactly.
The guys who do the costing of public health are the CDC.
Yeah.